When it comes to placing dental implants, we always take an X-ray before we actually start the process. Sometimes X-rays only shows limited information, not sometimes, mostly X-ray shows only limited information. So when we do implants, my always go-to diagnostic aid will be to take what is called a cone beam CT or a CBCT. The reason why we take CBCT is, one, for example, when we take an X-ray, in this, if you look at it, an X-ray will show the complete jaw in entirety. So looking at this X-ray, it shows that there is actually enough bone, but we won't be able to decide in the place where we actually do the implant, is there enough bone in terms of height, in terms of width, and in terms of quality. What is the amount of bone? It will be very difficult to predict looking at a two-dimensional X-ray. So now in this particular video, let's look at how a 3D CT scan or a cone beam CT scan helps in actually planning for the implant. Hello, this is Dr. Arun from Pearls Dentistry, running our dental centers at Chennai, Raja and Amalapuram since the year 2001. If you have not yet subscribed to our channel, please do subscribe to our channel, Pearls Dentistry. We've got a whole bunch of videos coming out in the next 1 year. So now let's look at how a CT helps in actually implant planning. So CT helps to reconstruct the entire jaw. It helps to see the jaw in entirety. So we know that for this particular patient, when we take a CT, that there is enough amount of bone that is there. But what is the actual volume of bone in the place where we are going to plan the implant? So if I look at one particular region, let's look at the lower front tooth region. Now when I look at it, I know that if you can look at this X-ray here, the slice, the CT slice here, the bone is actually resorbed a lot. Because the bone is actually resorbed a lot, when I'm going to measure the width, I can actually measure the width here. It's less than 1.5 millimeter width of bone. When there is less than 1.5 millimeter width of bone there, we won't be able to do any implants in this scenario. Also, when I look at the height of bone or the length of bone, right up to about 15 millimeters, the bone is very, very narrow. And because the bone is extremely narrow, the bone is resorbed, almost no usable bone is there available in the front tooth region to place implant. This is a very, very vital information which a CT provides, because when you look at the X-ray alone, it looks this area has got a lot of bone. But actually when we take a CT scan, we see that there is no bone. We won't be able to do implants in a CT. So that's the importance of taking a CT scan. So when I go further in a different area and then actually start measuring the bone, for example, in this particular area, when I'm going to measure the bone here, now we know that when I'm going to measure the bone, I can actually measure, there is almost 7 mm of wide bone there. And then when I measure the length to the nerve, I've got almost 19 mm of bone. So it means that when we go to another area, we can actually, there is a lot of adequate bone that is available to actually place that implant. And also we can evaluate the quality of bone, how dense the bone is. Also it will help us to pick up any infection that is there. So when you look at a CT scan, the importance of CT scan is to give us three-dimensionally accurate information for us to plan that implant. We can measure bone in terms of volume, in terms of what is the height of bone that is there, what is the width of bone, and also what is the quality of bone that's there. So that's the importance of CT. I always would definitely prefer to do a CBCT before we actually plan an implant. This is Dr. Arun from Pearls Dentistry. If you have any questions, please do comment in the comment section below. We'll be happy to answer. Thank you. Until next time, bye-bye.
Do you like the video? Press the like button. Do subscribe and click on the bell icon to receive such videos. Thank you.